translating research into impact and practice and policy. And then I'm hearing other folks talk who are maybe much more on the research side. And so if you look at it sort of along this continuum, we all sort of sit at different places depending on the balance between sort of core boundary expanding research, cross-disciplinary research, and translation of that into the applied science. But then if you tilt that axis a little bit and look at it on 3 dimensions, I started to realize too, maybe not realize, but just establish a vocabulary for talking about my feelings. Thank you for this, by the way. That we also, even if we operate with similar portfolios, we focus on different topical areas. Some on public health, some on medicine, some on engineering, some all different areas, sociology, and the social sciences. And in addition to that, on different geographic areas. So I think with the, oh my God, where'd I put my notes? Here they are. With the, so sort of representing, you know, there's so much to be done. There's so much to understand. There's so much work to be done that really, you know, our relationship among the centers is far more often collaborative rather than competitive. But then the other piece, it actually is the business of academia. And it's a number of years ago, I actually was sort of at a crossroads on whether to go for my PhD or my MBA, and I chose my MBA, so I didn't end up in academia. Yeah, so that clearly worked out. No, but the no, but all things aside, it's that no, I very much love and value where I work and working in academia, but it sort of gave me this perspective on the business model of it. And sort of in that meeting as well too, and I know in some of the discussions since then we talked a lot about the need for more funding, but also different kinds of funding, right? Different kinds of funding funds different kind of work, whether it's more mission-driven work of the agencies, more foundational research of the scientific foundations, but also within academia, there are a lot of incentives for promotion within academia that aren't always congruent with the kind of research that we do. Cross-disciplinary research sounds great, but in front of a tenure committee, if you have publications that don't expand the science but merely apply it in a hugely impactful ways, that may not get you where you need to go within academia. Within funding, we get these great opportunities on a short-term basis to do research, but it challenges being able to do it over longer periods of time, and even things with academic calendars and the way that academics approach the receipt and the implementation of funding is very different than in the private sector and elsewhere. So we have a great panel before you today, I think, to really talk about a lot of these different perspectives. And really, you know, it's time for us to talk about our needs. We have needs too, guys. Okay, we've spent the last 2 days listening to all of yours. Now it's our turn. But what are the needs to actually create vibrant academic centers and to create a field that is more than some great studies, but is culminating into a broader field of expertise, which is happening? How do we further that? How do we continue to make that happen? So I'm really, really pleased to be joined by my colleagues here today. We have Tricia Wachtendorf from, was I even close?
Yes.
I was, okay, great. From the Delaware Disaster Center. She's the director of the center as well as a professor of sociology there at the University of Delaware. We have David Eisenman, who's a professor in residence at UCLA, who actually broke quarantine to be here today. No, I'm just kidding, he didn't. It was a joke in poor taste, yeah. Too soon, sorry. There, he's the director of the Center for Public Health and Disasters at the School of Medicine, School of Public Health. We have Dr. Kimberley Shoaf from the University of Utah, where she's a professor and associate chief of community engagement with the Department of Family and Preventative Medicine. Close on? Okay. Close enough for go.
I say preventive, not preventative.
Oh, preventive. I get paid by the syllables, so. That's why I always say my full name, Schlegelmilch. All right. That's right. And then last, certainly not least, although nobody's least, I guess that leaves the wrong implication to say that. So Dr. Carlos Santos-Burgoa, who's the program director of global health policy at George Washington School of Public Health, and I think I'm really excited to sort of give us a broader look at how this plays out in a global ecosystem of research and practice. So with that, I'll sit down and I'll hand it off to my colleague to get us started.
So thank you very much to Tom and to Kendra and for those who have organized this wonderful workshop over the past 2 days. I have my cell phone here so I don't go over my time because there's no clock in this room, I just realized. And I do not have my 40 questions or 40 research questions that I'm going to present to you, like we just heard we need to have, which is probably a good thing for all of you at this point in the workshop. But we do have the ambitious task before us. We've been asked to talk a little bit about our centers or our programs, for those of you who might not be familiar with it, to talk a little bit about our roles or responsibilities as researchers as we define them, and then also to connect that to our research needs. So I will be looking closely at my phone and try to keep to time. As noted, my name is Tricia Wachtendorf, and I am a co-director of the Disaster Research Center at the University of Delaware. Our center was founded in 1963, and we focus on the social science and management aspects of disasters. Now, I do want to clarify that we are not all social scientists. We have social, engineering, and public health scientists represented on our faculty. That is not in spite of our mission or questions related to the social aspects of disasters, but it's because when we look at disasters, when we look at those social problems, we recognize that we need to involve different perspectives, different researchers, different training to answer those questions effectively. So we have 10 core faculty. We are in the process of hiring 5 more over the next 2 years. We have about 40 graduate students who are affiliated with our center, who are part of a range of programs, both traditional disciplinary programs in sociology, engineering, public policy, our new epidemiology program, but also our interdisciplinary disaster science and management program that draws all those faculty together and tries to tackle these questions in a very concentrated way. And we have 2 graduates from that program sitting right here, so they do go on to do wonderful things. We have several missions associated with what we do: research, education, and community engagement. And I'm going to talk briefly about what those are and how those relate to what we see as our responsibilities as researchers and what we do. So very much at the core of our focus is to try to develop research projects that solve complex social problems related to disasters. That is contributing both to large-scale basic science questions, theoretical endeavors, as well as focused on questions that are going to help those policymakers and practitioners in the field do a better job at what they do to save lives, to make communities their well-being, to foster that well-being in a post-disaster environment, and looking at that before the disaster actually occurs. We do that through quick response research of the kind of going to 9/11, 2 days after the September 11th attacks to New York City. We've deployed to Nepal, to Japan, other events around the US and internationally, but we also engage in long-term systematic research before, during, and after the disaster into the recovery period. We support our educational mission through those programs that I mentioned, training not only future scientists and scholars in the field, but also training those students and having them familiar both at the undergraduate and graduate level who go on to practice policy and into the private sector, having them be aware of that research and so how they can take that into account as they engage in their important work out in the field. Part of that educational mission also involves some special initiatives. One of the things that we're really proud about right now is that the University of Delaware has been named the flagship institution for the Bill Anderson Fund. For those of you who do not know about the Bill Anderson Fund, contact Norma Anderson, who is a phenomenal, the founder and phenomenal advocate for the work to increase the representation of historically underrepresented students pursuing PhDs initially, but more broadly thinking about disaster scholarship and hazard mitigation. So that is some work that we're doing both at UD, more concentrated now, working with partners and universities around the country, and more recently partnering with D.D. Bennett and the SURGE initiative that is located at SUNY Albany, but again, reaches around the country. Part of our work also focuses on community engagement, and that involves speaking to kindergarten classes. It involves being available to go to the White House for National Red Cross Day and give a presentation there. It's talking to private sector partners. It is doing media interviews. It's writing those high-level journal articles, but it's also doing op-ed pieces, posting blogs and information online, doing the preliminary papers of our longer articles so they're available for people to access. Any way that we can try to get the word out about what we're doing, about what the rest of the research community is doing as well. We have the E.L. Quarantelli resource collection. This is an archive of over 125,000 items specifically related to disaster social science and management. That is a library that hosts scholars coming from around the world to practitioners who come in and making use of that collection as well. So one of the things that we're trying to do is to grow that collection that's been building over the past 50 years, make it available for people to use, make available the data that we've collected over the past 50 years to work with us on that, and also to serve as a repository for scientists who are retiring, who might want to clean out their garage, or their spouse wants them to clean out their garage or basement, and being a home for some of those collections for scholars to continue to use that down the road. I want to share with you a few of the challenges and efforts related to the work that we do, and I'm looking forward to echoing some of the statements by my colleagues on the panel as well. So one of the things that came up over the past couple of days was the sharing of information and for scientists to go outside of their scholarly journals. I think that the people in this room, I think the people who are most embedded in the hazards community that you're going to be in contact with are doing that already. I mentioned a few of those examples. The challenge that we find is that you're still not getting the information that you're looking for. And I think that is an area that we really need some focused attention on. The fact that Craig Fugate was sharing such wonderful information yesterday, I could provide 50 citations for every line that he was saying. He's extremely well-read, extremely familiar with the research. But what always is a little bit frustrating is so many people in the room going, that's a novel idea. I've never heard that before. How do we really get that information to you? I don't think it's a matter of simply putting out a news sheet. One of the things that we're doing right now is we've invested in support for some graduate students to go through specific questions related to business and recovery and why people may not evacuate in a hurricane. We just picked those two topics because we're contacted about those frequently. To go through the literature, to do annotated bibliographies, to do a 3-page sheet for people who don't want to read those annotated bibliographies. We're making a video related to that for someone who doesn't want to read a 3-page sheet. So trying to use that as a pilot for getting information out and then to try to seek funding. How can we sustain this? Because we can't do that ourselves. So trying to think about those creative initiatives about what might work, what might be useful out in the field. Funding is a real challenge, and I think any of us can talk about the need for more funding, but the idea of the timing of the funding, I think, is key, especially if it's agency funding or philanthropic funding, but to some extent more the usual calls through NSF as well. We need to fund graduate students for that. Part of that is the appeal, right, as a broader impact for NSF or something that is appealing for an agency that we're supporting graduate education, supporting the next generation of researchers. I need to know in January if I'm funding a graduate student. So when I find out in September that I have, or August, that I have funding, yay, my grant came through, I might not have a graduate student to support because those graduate students have already been claimed. They've already been assigned to specific tasks. And that can cause then a delay in me actually being able to do the work. So thinking about those constraints of both educating the next generation and the timing of some of those initiatives. 3-year projects and trying to be transformative every 3-year project. That can be a challenge as well. So really trying to make a case for the, not incremental work, but the fact that transformative work builds upon existing work. And how can we better make a claim that just because we've been funded on something for 3 years prior, that we can build on that in a way that's important that leads to those transformative results, even if a 3-year concentrated grant doesn't quite take us to the moon. Taking us to the moon. I wanted to share with you a quote from a chapter that I have outside that I brought with me. This is a new book that was edited by Scott Knowles, who's in the audience, my colleague Jim Kendra, and myself, looking at some of the new directions of disaster science more broadly. It's an expensive book, so I brought you a free chapter if you want to grab it, or find a friend in a university that can download it and send it to you for free. I'll just read this one statement from it. What is missing from our field of disaster science are immense, glorious questions, ambitious objectives of the kind the space program demanded. Rather than asking how to get a person to the moon and back, our questions in disaster science have the potential to speak to the fundamental questions of human survival. As I walked into the building yesterday, I saw on one of those panels the 100 grand challenges, something like that. Thinking about what we are setting for ourselves to do as a community and working with the funding, the private sector, the community partners in achieving that. We need absolutely to focus on those questions that have immediate impacts in local community. But we cannot lose sight of this grander vision down the road that I think we have an opportunity as disaster scientists, both disciplinary and interdisciplinary, to work on and really strive for. That is a benefit that we can bring to the table and carve out that agenda moving forward. Thank you.
All right, good morning. That's really inspiring, actually, to think about our work as the grand challenge of human survival. I think we need to borrow that and use that. So, as Yogi Berra said, it's tough to make predictions, especially about the future. It depends not just on present trends, but also on unforeseeable future decisions. That said, something tells me we are in for major changes in public health disaster research. The interest in the state of the science exhibited here at this meeting that really grabs at the zeitgeist of the problem and couldn't come at a better time. The growing alignment between the public health disaster research workforce and the hazards research workforce culminating in NADRI. The National Academy's Committee on Evidence-Based Practice and the recommendations that will be coming from that report. The fact that we are experiencing the extreme weather effects of climate change now, and the pressing need to improve public health preparedness in the face of climate change, rising inequities, and globalization. These developments are aligning, I believe, to shift our national research program and priorities. So for the moment, for my talk, let's divide disaster research into two areas. We have gaps in our science knowledge, and we have gaps in our translation of existing knowledge. So I want to make first a plug for the basic science. Laramie Kolf gave an example yesterday of how he called or looked up Umair Shah's descriptive non-comparison group study about information regarding vaccine need in shelters and called that useful research to him. That made a great difference in his operations. Descriptive non-comparison research that never made it into the RAND systematic review that Art Kellerman talked about. It would not possibly make it into some of the work we're doing on national academies, but clearly it's useful. Lori pointed out vulnerable populations research, risk communications research. Much of that has been descriptive, non-comparison, but I challenge you to say that we are not changed in our operations and response because of all that research. So, just putting that aside though, I'd actually like to focus on the translation part. And what I'm going to do is try to be pretty, to Jeff's id, I'm going to be the ego. I'm going to try to be, let's look forward as to what we can do. If I was asked to design a dissemination and implementation science program from the researcher's point of view, here's what I would like to suggest. Now, in some ways, Wayne Doofus, I am Duffus? Sorry. Wayne, I am looking at you, but really what I'm saying here can be useful for any funder interested in dissemination and implementation science, and can be useful for any funder interested in development and testing even of evidence-based practices. So what I mean by dissemination and implementation science, just to be clear, this is research that funds, that is used to assist practitioners and community members and policymakers in choosing, adapting, and implementing evidence-based practices. Just one definition. So at the core, our funding is going to have to sustain practitioner and community-centered research that's going to develop, that's going to have trusting, pre-existing, reliable, and durable ongoing engagement and partnerships between research and that stakeholder community. Can't just develop that relationship for the grant. So that means really reimagining our contracts and grants. So that begins with contracts and grants and core funding that allows for engagement and partnership to be built and to be maintained over a long period of time. I'd like to think about something like the residency model that we have in medicine, where we actually might think about embedding researchers, for instance, in public health departments who could spend a day in the emergency preparedness response program or something like that, just to see how the questions arise, to attend exercises, to sit in the EOC, to contribute in some way to the writing of AARs, and to learn clinically what it means to be on that side of the disaster. Just one example. Funding that provides resources for research centers to attract and maintain relationships with community members, doctoral students, as Tricia talked about, and junior researchers from historically underrepresented groups. If we're going to do any kind of work with community, the absence of those researchers is a glaring problem. And as we have seen in a recent article in the American Journal of Public Health, in general, public health is losing its pipeline of workers. Disaster researchers, I can tell you, our educational programs, our pipeline of researchers is drying up, and we're going to need them soon. So I would imagine that these research programs would also be structured in ways, and not to say these programs, but these grants and contracts, would be structured in ways that permit meaningful revisions or refinements to the research protocols and to the budgets in response to the insights and feedback that you would get as a kind of embedded researcher or when you're working with the stakeholders. So I'm looking to think about more flexible, more responsive grant management strategies, including innovations in how we're going to make our protocols and our budgeting processes. So what about our research questions? Well, yes, ideally they should be comparative, a comparison between two or more interventions, for instance. But more likely, they're going to be evaluations of a complex intervention. By complex intervention, I mean something that has multiple outcomes that are a kind of complicated co-product of both the setting that it's occurring, the context, the event, the timing, as well as the content of the intervention itself, as well as how it's applied and who's applying it. Complex interventions have a definition in social sciences. You get the idea of what I'm saying here. These are what we are doing. We are doing complex interventions. And here, our learning is going to be necessitated from other fields. Fields like criminal justice or education, who have decades of experience researching complex social interventions and doing great evidence-based studies on that. But we haven't really been using those methods in our field. What that means for the researchers and for the funders is that these are not necessarily, like I said, comparison studies. These are more what we call theory-driven evaluations, where you actually kind of map out the logic of the program and then design an evaluation to test that underlying logic. And so there, the aim is not to find out whether it works, because inevitably it does. Well, let's say often it does. The purpose is to understand when, how, and why the intervention works, to understand how the setting, the context, and different applications influences the outcomes. So this also means retooling our research community to be able to conduct these kinds of program evaluations. And so in that vein, I'd like to see a research program that includes career development awards. These would be for juniors as well as potentially mid and senior level investigators. We might even be thinking about Fogarty-style awards that allow us to see how this is being done in other countries like New Zealand and elsewhere. And this would mean grant review committees that move away from kind of gold standard evidence demanded by funders to the kind of information, to understand the kind of information that we're talking about is needed by practitioners. So in response to a question actually that Tricia yesterday asked about how do we develop the agenda of what are the research questions that practitioners want answered, in short, because I'm going to wrap this up now, I would point our field to lessons learned by the patient, by PCORI, which is an acronym for the Patient-Centered Outcomes Research Institute, which has done great work on establishing stakeholder-centered outcomes, in that case, patient-centered outcomes, and about developing a research agenda through multiple methods of engaging with patients around the country. Finally, climate change is the defining issue of our century. In a year and a half, with a future administration, there will be prayer. There's a prayer meeting suddenly. There will be $1 trillion going into this field. Our work is on the climate adaptation side. The climate field talks about mitigation and adaptation. Adaptation has been underrepresented in the field for a lot of reasons. I think that's changing. Our work aligns with the climate adaptation side. It's what, certainly in public health, we do best, is that kind of idea of adaptation. And future research in this field, even if it's focused narrowly on disasters and extreme events, are going to have to deal with climate change at the same time. And of course, population health effects, planning for the health effects of an extreme event, focusing on equity, vulnerable populations, strengthening NGOs to advocate, training local leaders, all of that is what we've been doing in our field and what climate adaptation is going to demand. So I think if we don't tie our work into this interweave of climate change, inequity, globalization, we really do so at our own peril. Thank you.
So I am really short. So I'm Kimberley Shoaf, and I am currently professor of public health at the University of Utah and associate chief for community engagement and direct the Office for Humanitarian Leadership and Emergency Health. Prior to moving to the University of Utah 5 years ago, I was the associate director of the Center for Public Health and Disasters at UCLA. Was there for a long time. Thanks, Rich. I was going to say, those of you who know Walt Peacock Last summer at the Natural Hazards Workshop, Walt and I looked around, and giving a nod to Dr. Bissell and Dr. Scawthorne, we realized that we were some of the oldest around and had been around longer than pretty much everybody else at the workshop that year. And it's pretty daunting to suddenly become the senior generation of this field. I have been around in this field since pretty much the beginning of the field of emergency health. When I first started looking for my very first job out of graduate school as a faculty member, they said, well, disaster public health? What does that have to do, what does disasters have to do with public health, and do you do any real public health research? This was at WVU, and I said, you do know that like the classic disaster study happened right here in West Virginia, right? That all of the social science disaster research is built on what happened in West Virginia. So I have been around a long time, not quite that long, but I'm not that first generation, but I do give honor to that first generation that came before us. On whose shoulders we all stand now. But some of the things that I really appreciate, Trish, your comments about the fact that all of us in academia have a threefold mission. It is to generate knowledge, to transfer that knowledge to a new generation of scientists, and to translate that knowledge into the social good, to do community engagement, and to ensure that that knowledge that we generate is translated into practical use. And every one of us are part of those three missions and do those things. And we do them in different ways. And I will tell you that in public health, unlike in medicine and emergency medicine, we are not practitioners at the same time that we are academics. Most of us who are academics in the social sciences, and public health really is a social science, we borrow almost all of our methods from the social sciences and our theories and everything else. But we apply that to the health of populations. We are generally not practitioners at the same time. We aren't working in an emergency room and doing operational research while we're taking care of patients. We are separate from that. But if we're doing our job well, we are engaged with the public health practice community. And having those connections is vital to us being able to be good educators, good researchers, and to conduct that third part of our mission. At UCLA, my program at the University of Utah is very new. We do have a new office, the Office of Humanitarian Leadership and Emergency Health. We have a certificate program where we train graduate students in emergency public health. It is an 18-unit graduate certificate that they can earn alongside their Masters of Public Health, or independent of that, where we have practitioners come in and do it as well. Currently, it is just in emergency public health. We do have plans to add a track in humanitarian leadership and a third track in healthcare emergency management, because emergency management in the healthcare system is different from what an emergency manager in a community does. And currently there is no training program for healthcare emergency managers. But that's a ways off as we get our feet under ourselves. We are developing, right now, I have been the only researcher in our division that does this, and we have recently hired a former colleague from the Utah Department of Health who finished her doctorate a few years ago. She has come back as a faculty member. She was the FEP coordinator for the state of Utah. And she's now a faculty member and a colleague in our division. So there's now two of us, so that makes us officially an office or a center, because there's more than one of us. I had so many thoughts about the kinds of things that I wanted to talk about in terms of what our needs are as academics in this field. The first one is really defining what this field is. For so long, it's been, oh, you do disaster medicine. No, I don't do disaster medicine. I am not a physician. I was an EMT. I have done all of those things, but I am not a physician. I don't do disaster medicine. Second, it's all about injuries. No, it's not all about injuries. A lot of it is infectious disease, and you're not the only, where'd he go? You're not the only infectious disease doc in the room. Gavin is here as well, so we do infectious disease as well. There are lots of things that are involved in terms of public health and disasters. We also have to, we have to train our students. That's an important piece of what we do. And we train practitioners and researchers. In a Masters of Public Health program, we are basically training the people who are going out to public health departments to be the practitioners to run the next emergency. And so we need to understand what happens in those fields. At UCLA, I worked with, there are 57 counties and 4 independent health departments in the state of California. I worked with all of them at some time, either doing their workforce needs assessment for preparedness, their plans, their exercises. I made lots of health officers cry. Umair was not the only one. And I made a sheriff sit down and shut up one time when he wanted to know the scenario before the exercise happened. And I said, no, it's not gonna happen. The terrorists aren't gonna tell you either. So you can just call me a terrorist, I guess, that you're not gonna do that. But we need to be able to engage with those people on a level playing field. They need to respect us and trust us, and we need to respect and trust them. And because of that, we had a lot of research opportunities. Rarely is this, the public health comes to you and says, oh, I have a research question. Can you do this research for me? And they want to work with us to find funding to do that. They need those answers now. I hate to tell you this, guys, academics' pockets are not full of money and time to be able to answer those research questions without additional funding from someplace. It just doesn't happen. And so we need to find ways to do that because they don't have time to wait for an 18-month funding cycle from NIH. They want those answers and they want them now. Hopefully, state health departments have money that they can do some of that. I had a number of contracts from the state of California. I've had contracts from the state of Utah to help me, to fund me to answer some of those basic questions. During pandemic, prior to the pandemic, the state of California wanted to know, how do we communicate to the population that everybody's not gonna get care? How do we do that? And so we worked with them to do a 2-year research project with the residents of the state of California about austere care. And how are we going to make decisions and triage who's going to get care and who isn't going to get care. Those are the rare circumstances that we get that. Otherwise, our funding is pretty limited in terms of public health funding for disaster science. I suggested that maybe at next summer at the Natural Hazards Workshop that we need the director of NIH because we need to have funding specifically for this field. If you look at all the institutes in the National Institute of Health, and this is not to disparage at all what is going on in NIEHS, that is fabulous, but it's a small piece of what we do in public health, the environmental health side. We need to be able to look broadly at this and not have to pick and choose from, oh, I'm gonna submit this one to Aubrey and hopefully he's got the money, they've got the money there that they can fund that. Or I'm gonna compete with every other social scientist for that tiny pot of money at NSF that is applied to social science, and I was very disheartened yesterday when Robin talked about the fact that it also has to have an engineering component to it because it's like, Bill Anderson is turning over in his grave when we talk about things like that. We need to be able to do that. We need to look at these kinds of things, and I think I'm getting the hook here. But I just wanted to touch on one other issue, and that is the methodological issue. We know that we need to advance our methods in disaster science. It's not easy to do that if you don't have funding for it. And so we need to have this stream of funding that will not only fund the research, but fund the research into how to do the research better. So, thank you.
Wonderful, thank you.
Thank you very much. Thank you, Tom, for the invitation. As everybody introduced themselves, I will say I am an intensive care physician that I dropped from clinical medicine because I said I have to go and do and prevent all what I am seeing. However, I went into public health and I had to confront atmospheric emergencies, volcanic eruptions, earthquakes, emergencies, floods, chemotherapy, and the H1N1 pandemic. And said, come on, I wanted to prevent everything, and I am having to confront all these disasters and all these emergencies. So I want to build my talk around the experience that we just had with the Puerto Rico disaster. Everything started in September 20th, 2017, with the huge Maria hurricane. And after that, a political crisis happened. It was a political crisis around counting how many people have died. It was a political crisis around the management of the emergency, but the political crisis about the communication of what actually happened. So it was a mixed. By December, September, and by December, the governor decided that they needed an external group to assess the mortality, and that's how the whole thing started with us. Craig yesterday said, why mortality became so politicized? Well, that's an interesting question. Why it became so politicized? In the beginning, it was politicized because of all this conflict. By the month of February, we were already starting this project. And we were able to identify distribution in the whole island of Puerto Rico of the mortality. The epidemic curve, you can see the historical mortality over there, and then the peak in the mortality. So it's a typical epidemic peak as anybody has seen epidemic curves. This is another one. But see this graph here, you see an increasing trend in this blue line, and this blue line are those in the poorest areas, living in the poorest areas of Puerto Rico. Incredibly, we were starting in February this study. This was already happening several months before, and that is really something that is very interesting. So I want to talk about the methodological challenges that I think that we in academia have, highlight the need for research during the event, and this is very applicable to the mortality thing, the interaction with disaster management, the funding challenges, and the outreach about this. And the methodological challenges are very, very important. I have found that disaster response is very committed to the actual operations or the actual response, not to the scientific inquiry. And we have seen that in this meeting. Little time to think and solve questions. But there are many questions that need to be solved. The thing is that we have to gather those questions and be able to solve them. Everybody in this field are used to respond. They are quick, they want to do things and act. The retrospective assessment of response is seldom done and seldom funded. However, the impact on disasters is important. There is a social need. People want their family members to be accounted. people need to identify the number of people who have died, what's the magnitude of the effect, to compare. That's when you show the funding for Maria versus the funding for other hurricanes. It's amazing the fraction of funding that has gone to Maria in comparison to that one. And importantly, we need this to communicate. How do we communicate the impact? And there is a need to respond to needs. Importantly, we need mortality to guide the response. Here, really, if we would have had this data in the beginning, in the first weeks, would have we done the things differently in Puerto Rico? Would have been tried to find those who were the poorest and try to find them where they were in that moment and try to take care of them? Maybe yes. And importantly, to be able to communicate impact. We have found that we have a lot of tools to communicate risk communication, risk preparedness, and all that. But how do you communicate impact to the authorities and to the people? And that's something that we don't know. We found communities in very bad conditions that had 0 deaths. How come? Those were very resilient communities. What can we learn from them? I think those are important things. And identify the performance of the public health system. The public health system has to become a core driver of the response. Maybe not the driver, I agree, but it doesn't have to be in the back seat. It has to be in the core driving seat, because it has to help to say where the problems are. What we know in terms of mortality, we know, I think that now we can say very easily how to estimate total excess mortality. We can find what's the normal trend and find these spikes. You do need some modeling, but that's not science fiction. Everybody can do this. We have to do equity assessment essentially for effective interventions. Without equity, it's not just social justice, it's because if we want to be effective, we really have to assess equity. And we need to have a link from vital statistics to surveillance, to epidemiologic surveillance. And we don't need the total death certificate, just the notification of somebody died, where that person died. And let's have it on time, on real time, as soon as possible, so we can target our response. What is less known? What is less known is why people die several days, several weeks, or several months after the event. Yes, there are infectious diseases, but chronic diseases are also extremely important. But what is the mechanism? We don't know that. Why this happened? Why we had 2,975 deaths in Puerto Rico? We don't know. We don't know the mechanism of why this happened. And we have to know those mechanisms in order to stop it for the next time. Because the next time, yes, it will happen. We will have a next event. And we're having next events. We have Florence, we had many other events. And that's are happening. And if we don't understand the causal path, we will never stop that causal path from happening, and that will keep on happening. So we need to do that, and obviously for certification, that will be needed. And this has to be communicated again, to decision makers, to responders, to the media, and to the population. They have to understand this. How do we translate this into easy words so everybody can get this? So here the critical thing is the interaction with disaster management and decision making. I do dream on this interaction between the responders, and the scientists together. Certainly, timeframes are quite different. But scientists, we have to adjust to responders. But we have to have the resources to do that. There has to be someone in the agencies, in the government, to understand our science. And journals have to understand the importance of publishing our results. In our case, we publish our results in Lancet. Yes, but before that, we had the results, we had the final model, we had the final estimate. The governor had, and the government had to act, and the communication had to be done to the public. So we had to negotiate with Lancet that we were going to release the results before that. It was a painful and difficult negotiation. Journalists don't understand that our main obligation is with the public and with the public health. And period. That is essential. Principle-driven decision-making. That's it. So we had to communicate it, and we did communicate it, and we published the report way before it was published in the Lancet, and later on epidemiology. We have to have data ready in every Department of Public Health to do the forecasting and the analysis. Ethical and legal responsibilities. Our commitment is with the communities. What happens with IRB? What happens with data use and share agreements? You would not imagine how much time and weeks we spent on data use agreements and back and forth between Puerto Rico and us, and within my school and the legal department within the university. It was a mess. Data security and all that. And then how much evidence really the governor and the people in Puerto Rico really needed to act? That's something that we have to think about and say, okay, how we show them contradictory information. They had a lot of other people doing research, publishing research, and people said, oh, the former director of FEMA said, mortality data is all over the place. He used that said, well, we pulled together all the different reports. And what was all over the place were the dates and the periods of time of analysis. But basically, if you think about the data and the confidence intervals, most of the data are quite consistent. The only difference really is the kind of modeling that we did that was different. So my final slide is on the challenges for funding. I think that yes, we need funding that has to be ready for immediate response, but it is absent, I would say, for methodological development. So far, we have found this extremely difficult, very difficult for committing doctoral students. We have lost several doctoral students about this. On the global scene, I would say yes. On climate change, it is an essential thing. I am concerned that we are completely underestimating the impact on mortality from climate change. The SDGs has an indicator, number of deaths attributed to disasters. Okay, if we do a good assessment, really, this has to be changed, and United Nations has to check on this. And I am very glad that we have this opportunity in this meeting to discuss this. I think this is the first time that I have had this opportunity to see all this, and thank you very much for.
Great, thank you, and thanks again to all the speakers for such a great overview of all of the issues. I actually have a page full of questions, but I'm going to hold off on those because I want to make sure in the remaining time that we have a chance to address your questions. So if you do have some questions for the panel, you can go ahead and come on up to the microphones here as folks kind of think through their questions. You know, I think we, oh, here we go. David, why don't you go ahead and get us going?
Thanks very much. David Abramson from NYU. So I love the presentation. Obviously, this is our world that you're reflecting. And Tricia, I wanted to sort of ask if you could expand a little bit on the grand question that you were posing to us, because I feel like this whole workshop is designed to be for us to think, what is the state of the science? Where are we? Where do we have to go? And we've got a couple of different scientific disciplines that are sort of have been operating in parallel, the natural hazards, disaster research world, now the public health world. We're kind of coming together. And the question is, what do you foresee, and maybe this is true for everybody there, but where do you see the sort of the grand science evolving? Are there systems research types of things that we're going to be doing? Is it big data? Is it ecological data? Is it using multiple types of data to try and answer the kind of questions of what's the context that makes a difference? How do we answer the broad question that you have in mind, and how do we get to that point? And maybe furthermore, are there many steps that we need to take to get there to substantiate the research base? Is there enough research base now to have us propel to that next level? Are we ready for that? And what is it?
In 30 seconds.
Please.
So I think that the specific questions that you ask about the methods, I think the answer is yes to all of those. But I think that we need to have not necessarily just one. I mean, I keep drawing on the analogy of sort of space science. You can aim to get to the moon and also aim to get to Mars at the same time, and maybe the moon is a little bit closer. But those are questions that I think demand not a single researcher or a single group of researchers, but really a community of researchers. You mentioned the kind of the disaster research and the health, but climate adaptation. There's a lot of parallel work that's going on there, and a lot of things that we in our domain can learn from that as well. Where are we headed? And I don't know that we've defined that. I think we're tackling these incremental questions that are important, that are pressing, but we're not looking for a strategic way to build toward something else out there as a goal. I think to do that requires funding, certainly, and it requires that political will, not only within different agencies, but being able to make the very strong case to, if we think about nationally to the American public, to decision makers, that this is something that we are going to prioritize, and to draw on our international partners to help us make that case here. It's more than just having another center of excellence, honestly. That's not going to solve it. It's a decision that we make as a broad community that this is something we value, that it's important, and we're going to commit to it.
I wonder if I could just follow with just a brief question. Do you have any, maybe again for anybody on the panel, do you have any illustrations of multidisciplinary research where the research sort of evolved and was not just a single discipline sort of running the research, but that they sort of emerged with something that was different than any single discipline? Have any of you had that, either seen it or conducted that? Because we've talked a lot about this, and we're just kind of wondering, how do we do it?
So let me just, from the beginning of my career, the majority of my research has been interdisciplinary. And I mean truly interdisciplinary, partly because I started off in earthquakes. And the earthquake science field was dominated and was dominated by our engineering colleagues. The National Science Foundation funding for social science and disasters is in the Directorate for Engineering. And so much of the work that was done was with engineering colleagues. We started off, my first research project after the Northridge earthquake that I had funded was an interdisciplinary team of 3 public health people and an engineer that we had an injury epidemiologist, a public health practitioner person that was, I come from the practice side, an engineer, and another epidemiologist. And that work then built into things that none of us could have done alone. And to this day, that those connections are there. And whenever I'm working with something, it is something that I almost always say, is this something that I need to have engineers? And then with the engineers, it's sort of, oh, wait, this is a question that I can't answer. And I think the stuff that Judy and Tom have done together and looking at hospitals, there's no way just a physician or just an engineer could do that kind of work. We need to be able to work across those disciplines, and in many ways it builds new disciplines. You know, Judy often says she's not a traditional engineer, and neither is Hope. They're not traditional engineers. Neither is Charlie. They can speak across that chasm to other disciplines, and that's important for all of us to be able to do that.
I just want to not let this opportunity go. It's also looking to these other fields that have less of a presence. I think the humanities, I think the arts, I think we have somebody who studies the history of science who has would provide important insights on that. So it's not just kind of looking to those usual suspects, but really expanding those disciplines to push us beyond kind of what we know, the answers we can provide, and move us in that different direction.
I just want to add one thing to David's question. One, I think that, you know, the methods development is critical. As I mentioned, other fields that have dealt with complex social issues have evolved really almost at this point registries of evidence-based practices and complex interventions. They've done this in education and criminal justice, which are dealing with, you know, criminal justice and education are dealing with very complex outcomes and systems just like we are. So they've done it successfully. So I think we can look towards other fields. I would say that the answer to your second question of who's done this is right in front of our nose, public health. I mean, as Kim mentioned, we are a social science essentially dedicated to the topic of health. Our schools of public health include economists, community health scientists, epidemiologists, biostatisticians, all sorts of different sciences, all working towards a very large and growing defined outcome called well-being and health that expands to greater numbers of units of analysis all the time. So I think we've done it in public health.
If I just want to add 2 things on the moon or Mars. I think that Tom Kirsch showed yesterday a graph where we have seen no change in the total death rate over time from disasters. I think that's unacceptable. I think that really our goal has to be to contribute to lower and eliminate that death rate. So we have to define what is our goal. At GW, we have now received a small grant for cross-disciplinary research. So we have the School of Engineering, we have geographers now working on the data set that we have on Puerto Rico. And I think lots of things are being learned from that experience.
Great. So I've secured a few more minutes for us. Thank you, Tom. So I want to get to the, hey, you know, you ask, I deliver. And so we've got a couple of folks standing up to questions. I want to make sure that we get to them, sir, and then we'll come over to this side.
My name is Gus Ventura. I graduated from GW School of Engineering in disaster management, emergency management. I did my research on evacuating hospitals, and I used system engineering methodology to approach it because it was such a complex event with so many different disciplines within it. has that been considered as maybe one of the core methodologies we can draw from? Because when I presented it, there was a lot of discussion that hasn't been applied to research studies.
I've seen some interesting applications of it. I wouldn't go as far as to say there's a field of researchers working on this, but I have seen systems engineering sort of crop its head up in a lot of these complex problems, particularly around healthcare with some of the academic researchers as well as through groups like RAND and groups like that are sort of built to bring in the cross-discipline. I think there's just in my humble opinion, I think there's tremendous potential to apply some of those methodologies to some of those kinds of problems.
I totally agree. Thank you.
Yeah.
Yeah.
Okay. Sure.
So I just find the topic of disaster risk research communication to be really fascinating. I think we've all come to know that professors are not necessarily natural communicators. I mean, you can have some that are very talented at it, but then others, it's not part of a professor's training. And so I wanted to hear from you, from this panel, and maybe also from people who represent more on the practitioner side, but if we had an ideal situation where we had all the funding that we needed to do the sort of communication that needs to happen in order to get research from the side of research into the side of action, what would that look like? Who would be doing that, or how do you imagine that working?
So let me just tell you, there's actually a lot of research around risk communication and disasters and how do we do it and who does it and what are the media that we should be using. I would invite you to come to the Natural Hazards Workshop where lots of the researchers that are doing that are there. We also teach risk communication in schools of public health. It's one of the classes that is taught at UCLA. Dave's colleague at UCLA, Deborah Glick, does a lot of that research and teaches a class in risk communication. So it is something that is definitely on our radar, and there is a lot of research going on in that area.
Hi, I'm Elizabeth Andrade. I worked with Dr. Santos-Burgoa in the Hurricane Maria study, and I led the team that assessed crisis and emergency risk communication in this case. And a few things, just building on what you've said and also responding to your question, I do feel like although there is a very extensive disaster psychology literature and also risk communication literature, there are some gaps that are not really being filled right now and that I think we should be taking a closer look at. And one is related to what Dr. Santos-Burgoa mentioned, which is impact communication. Some of the topics covered in the Crisis and Emergency Risk Communication Manual or in the WHO manual from 2016, they just, some of them are not adequate for communicating impact issues, right? It's not just about communicating risk for post-disaster about how to protect yourself. It's more than that. It's communicating to the public about what happened and making clear the information we're conveying. And the other issue is related to catastrophic events. So going through the Crisis and Emergency Risk Communication Manual, a lot of the guidelines are, you provide this information to the public. Well, all the telecommunications are down. How are we supposed to do that? There's some gaps in research about how do we expand upon what already exists to make it appropriate for the increasing frequency of catastrophic disasters that we're going to be seeing, and also post-event communication. And even if all of the CERC best practices had been applied in the case of Hurricane Maria, still there would have been a communication crisis on our hands.
Yeah.
So I just wanted to put that out there.
And I'll just add too, kind of on the academic side, that on the one hand, I think it's not necessarily a bad thing that certain scientists aren't going to speak in public dialogue. It's important to have publications that are virtually unreadable to anyone without a PhD. I mean, that's how science is built. But I will say that there is a. Actually, I was being serious. So the but I would also say that there is a need for that translation, and so we're either really good at mass communication and tweet lengths and 256 characters, or the peer-reviewed journals in that interim space in between. And I will say too that academia is not always a friendly space for non-peer-reviewed communication. If you're out there doing a lot of media, if you're out there doing a lot of op-eds and things like that, which are very critical, I would argue, for translating that message, sometimes makes you perceived as not as serious of a researcher. And so I think even culturally, some of the cultural paradigms of academia need to adjust to this as well, too. I think so I just want to get to one more question here, and certainly want to remain available and to questions sort of in the halls and everything as well, too, for everyone. But so you have the last
I
word.
just want to thank you for the last question. Go back to the point we're talking a lot about questions, and one group that's not at the table is our communities, right? And hearing their questions and creating the platform to hear what they need, what they're interested in, and what they're concerned about is critical to integrating with our research questions as well. We did something with the oil spill I thought was interesting, which we kind of stood up, NIH funded 4 centers across the Gulf that had to work with NGOs and communities across the Gulf in order to hear their questions and then work on researching those questions in somewhat a transdisciplinary fashion. I'm kind of interested in, one thing, you guys represent differing viewpoints on this, but I'm trying to think from your viewpoint, how do we do better at integrating and responding to the community's needs and true concerns at their level?
I'm excited by that, but the work that you had invested in doing that. I think one of the challenges for researchers who are really wanting to bring in communities from the start is that there is very little mechanism to allow them to do it. Those community members are busy. They're working during the day. They want to spend Saturday with their families. So even thinking about it in a non-post-disaster environment, it's impeding upon their time, and they want to make sure that that's productive. We found even in terms of having communities write letters, Scott Miles and I were just discussing this, if you're writing letters for an NSF grant for broader impact and you don't get the grant, how does that community feel about, they've put this time, they think something's going to come from it, they wait the full year for the review, and then it doesn't get funded. So there's small steps that we can still do on the fly and foster those relationships, but it becomes very difficult, especially for junior researchers who are on the tenure track, who are having to look at, am I going to get promoted, to be balancing that. I have a little bit more flexibility as a senior faculty member, but I don't think that our funding mechanisms allow for that sustained work in building those relationships, in not just sweeping in and saying, what's your question, but having that really emerge over time.
I would say I think it's extremely important for us not to parachute where you go. Just go and do your research and get back. No, I think that you have to go and get completely involved with the local people who are doing things. I know that they are busy responding, they are busy being survivors of the problem, but we have to get them involved in our research and try to get as soon as possible in touch with the local communities and try to listen to their concerns. I think that has to be a rule of thumb. It has to be essential for every action that we do. This is not happening in our communities, it's happening in somewhere else. So we have to make sure that we do it collaboratively.
I would like to, I think, put a plug in for a grander conception of our future research enterprise here. That would include, say, if we do someday have an NIH institute, a stakeholder board that is one of the groups of stakeholders would be community members that are assembled, chosen from different NGOs or communities or long-term recovery organizations that have been historically active and are now ready to digest and give ideas. There are lots of places to get these kinds of members, to constitute that kind of board, to work in a methodologically sound way to start to isolate priority research questions, to isolate priority outcomes that matter to those people, and to think about ways to build on that. We saw in PCORI, which I will go back to because I have seen how PCORI worked over the years, a website that would open up and take questions from patients and use that as one of their strands of input for developing their patient-centered outcomes and their patient-centered priority research questions. So, you know, being in DC, I think it behoove us to turn to the PCORI people and find out how that worked, how well it worked, what they learned in terms of the process.
Great. So with that, we're at time. So let's get a round of applause one more time for our panelists here. And great. Let's keep the conversation going on this. Really great information. Thanks to everyone.
Thank you very much. That was great. So one last thing. We've asked Dr. Deitchman to give a summary of these proceedings to kind of bring this together for us, which we're going to use to kind of go on to keep pushing this topic. We're going to put out some papers. We're going to hold a series of webinars. We're going to keep engaging all the different communities that have been brought up here. So I just want to give a brief introduction. Scott and I met a long time ago. We were actually preventive medicine residents together. Since that time, my career went on to be disastrous, and his went on to be illustrious in that he served for more than 30 years in the public health service at the CDC, rose to rank of Rear Admiral, retired recently, and has been instrumental not only in disaster science, but also kind of in the area of disaster leadership and crisis leadership and managing big responses. So I think he provides a good perspective for us because he's quasi-academic and quasi-federal, and I think can speak from both points of view. So, Scott.
Well, thanks, Tom. I've been called many things in my career, but this is probably the first time I've been called quasi. I have an interesting challenge, and that's to summarize in now about 10 minutes about a day and a half worth of great ideas from some really knowledgeable speakers, both here at the podium and contributions from the audience. And I want to start by apologizing that I really have to condense, I have to truncate. There will be many of you who were offering great contributions that I won't be able to identify by name, and I apologize for that. I also want to warn you in advance that because the presentations ran up to the last minute, I'm going to be doing a lot of abstracting on the fly. So there are times when I'm going to look like that YouTube video that you were watching over a really slow connection, and I'm just going to stutter occasionally. You know, wait, the data buffer will catch up, and I'll start talking again. The major themes, there were definitely major themes that came out of this presentation, out of this conference, and they're not going to be surprises to any of you. They were not necessarily in this order of presentation or priority: communication, coordination, cross-disciplinary collaboration, methodology and the need to refine and develop it, and funding. And I think most of our speakers touched on one or more of those in different ways, and part of my challenge is to try to draw out key points or cross-connections. Art Kellerman started off, I think, by setting kind of identifying the low bar that we have to get over, and that is that based on the research work that he and colleagues did at RAND, identifying the fact that we had a big problem in disaster medicine in how effectively we were sharing our information, but we had perhaps an even bigger problem that we didn't have very good information to share. And that point was echoed by a number of subsequent people who talked about the need for more rigorous methodology, and more rigorous attention to how we disseminate our results. The first person really picked up on that afterwards was obviously Craig Fugate in his extensive presentation, who kind of drummed into us the need that we have to not only communicate in scientific language that's accessible only to our peers, but also in language that could be easily understood by operators of various educational levels and with key SACOs that they can readily translate into operational practice. Craig spoke to the shortcomings of after-action reports, which I think was really an interesting response to Art Kellerman's call for a repository of AARs. Craig was sort of polite in using the word fiction. But I think that it was important, the specific shortcomings that he identified in after-action reports. One of the things he identified as a challenge is that people are reluctant to do what they see as criticizing their peers. You know, those of you who have come out of healthcare backgrounds, particularly physicians, will know that this has always been a problem with what we used to call morbidity and mortality rounds. It's no different in disaster medicine. It was an issue that I saw in my work at CDC. I was frequently the incident commander for responses, and we would have these little get-togethers afterwards to contribute information to the after-action reports, and I tried to think, I saw this problem, I tried to think, what could I do to facilitate people's willingness to be open and honest in their assessments? And so the approach that I took was to lead off by critically analyzing my own performance, thinking that this would create a safe space for other people. And all it really, yeah, you know where I'm going with this. Basically, all I accomplished was that the whole world understood what was wrong with my performance. And Craig basically ended up vouching for an idea that Tom and colleagues had put out earlier this year, which was the need for a National Transportation Safety Board-like model for going in and assessing our management of disasters. And as he pointed out, the airlines and the FAA don't usually like what the NTSB's conclusions are, but they respect them. And they influence subsequent policy decisions. Craig's talked a lot about communication in many ways, talking about the EOC as a venue for promoting communications between responders, including not just government agencies and NGOs, but also the private sector and the public, so that I really liked his term that the EOC becomes an engine for problem solving. He talked about the importance of plain language, which came up over and over again during this conference, and gave some examples of how failure to use plain language adversely affected our ability to influence the decisions the public made in some very dangerous situations. That probably resulted in increased deaths. Craig was the first one to talk about the importance of empowering the public, another theme that kept coming up during this, that we can't continue to simply think of the people in the affected area as the victims who are expected to sit on their hands and wait for the cavalry to arrive, but that we need to empower them with information both before and during the event in order to help them help themselves. And he touched on something that is of great personal interest to me, which is how do we effectively reach out to the public after T0, when so many of the conventional communication systems are down, and yet that's when the public both needs that information most of all and is probably most willing to hear it. And he spoke to the need for disaster exercises that aren't an opportunity for us to show how effective our plans are, but are venues where we are willing to break the system and see where we're really vulnerable, because that's what happens in disasters. Then we went on to panel number 1, which looked at current federal disaster research. It was really more of a review of current disaster research programs in government rather than a review of specific projects. And I think for me, the big take-home lesson from that is that there are a lot of places going on in government where research is being done without the label of disaster health or medical research, but research which, by virtue of the problems it's addressing, ultimately leads to the ability to better protect the lives and healths of the populations. And because of that, that research can be a springboard to identifying ways that we can better protect the health of the public. Dr. Mithrani Reiser talked, for example, about how NIST is really a standards measurement agency. And their work on building codes was sort of the entree into the creation of the National Construction Safety Team. They're all about looking at buildings. What went wrong with the building? How do you better design a building to be resilient? And yet, the goal of doing that is to ensure that the building doesn't collapse and kill people, and that the building is resilient enough to continue its core function after the disaster. And if that function is a healthcare function, then that is another way that this research leads to improving health after a disaster. And we heard about a number of other programs that at FEMA that sort of similarly can be bridged. Aubrey talked about the Disaster Research Response, DR2 program, an effort within government to provide research tools and models so that the disaster researchers can get into the field, can be ready to get into the field faster and collect if what is really ephemeral data. If you're not out there getting it when it's happening, it's going to be gone. And the need for researchers to be prepared in advance, to have formulated in advance their research questions, their research tools, their research methodologies, their IRB approvals, was again a theme that kept coming up in multiple presentations during this conference. I want to highlight something that came up in the Q&A during that particular panel, and that was when Laramie Kolf said something to the effect that we can't support in the research in the middle of the response if it's not immediately going to have direct benefit to patients or will improve the efficiency of responders. And I'm taking those words literally, and so Laramie, if I'm misinterpreting you, I'll apologize in advance. But Laramie identified a tension in this sphere that has been going on with disaster responders for a long time. There is a feeling that we need to concentrate on the response that's in front of us, and anything that's a distraction from that is going to hurt people. Focusing on research that will help improve the immediate response is sort of the bridge, but it doesn't address the question that I think is very real of what happens, what about the data that we collect now that we need time to crank through? We need time to review our conclusions with stakeholders and policymakers. It's not going to be able to affect this response, but it may be critical for improving the next response. Laramie did us a favor by identifying that tension, and I think it came up again in a subsequent presentation. We need to be mindful about that, and we need to figure out how to address it. The last session of the morning was Lori Peek's presentation from the National Hazard Center, and Lori, I want to congratulate you. I think you get the award for the most energetic presentation of the seminar. But she addressed this issue of cross-disciplinary collaboration through what she called convergence and the National Science Foundation Converge Initiative. And because of our limited time, I'm not going to go through all the points, Lori, that you presented here, but I believe you have a very well-crafted website that I would urge you to go to see what are the core principles they're identifying and what are the avenues that they're providing to promote that kind of cross-disciplinary collaboration and to get involved in it. In the afternoon, we had a panel on the needs of state and local responders, and I want to identify a couple things that Megan McGinty said, because I feel like they very nicely kind of codified some things that a lot of other people were thinking about, and that included the limited capacity, capability of local health departments, the challenges of thinking clearly about what we mean when we get consent, because the population that we're studying is already disadvantaged, and it's the same issue really about medical research in clinical medicine. How do you ensure that a patient who wants the latest treatment, even if it's only available on protocol, is really consenting to participate out of the same free will they would have if they weren't in a disadvantaged situation? The populations we're trying to help here are in the same situation. And I am greatly abstracting here because of the short time frame. We had panels on funding opportunities from federal partners. Each of these speakers, I think, has websites that sort of highlight the individual mechanisms that they presented here, and I don't think we need to recount them. I think that one message that sort of implicitly came out of that is that when we look to federal agencies for funding, we have to accept that they are prisoners of their agency mandates, and the only funding that they can offer is that which is going to be consistent with the mandates that they are charged with meeting. And if those mandates happen to be too narrow for some of the questions that we need to address, then we're going to have to look elsewhere. And it's probably not realistic to expect those agencies to behave differently. It's out of their control. And there was no discussion in that seminar of funding from corporations or foundations, but fortunately, that was addressed the next day. Rita Colwell concluded the day with discussions that were based on the report she prepared for the American Academy of Arts and Sciences, Science During a Crisis. Again, that report is freely available online. I downloaded it on Wednesday night, and again, would urge you to look at that report for some of what they think should be the priorities. The one priority that I want to call out that she identified was we need to better understand how our research can influence policymakers, because that really is where the rubber meets the road. And she identified some thoughts about a council of science advisors to governors, how that council should be involved with the science advisor to the president. I think that's important because those are ways that we start to get close to the elected officials who are the policymakers. There was a question that was raised during the Q&A for that session, which was what happens when conflicting scientific data are presented to decision makers? And I was intrigued to notice that the panel really didn't touch it. It was not answered. But I think it's a question that we need to keep in mind and think about how we are going to answer. And that takes us to today's presentations, which talked about funding sources outside of government. And I think one of the key messages from that is that those of you who are conducting research and are looking for funding need to recognize that, just like we said about the federal agencies the day before, the private sources of funding are really best approached when you can think about what is it that philanthropic foundation or that wealthy individual is really interested in. What's going to catch their eye, and how can you show them that your research is going to help them be able to say, this is how I made a difference. So along with everything else, we have to be experts in marketing. And I want to mention in that reference to that presentation, Glenn Dawson, whose presentation on the GSD, I think gets my award for the presentation that most made me say, gee, I wish that had been around when I was younger. Something else that came out of that presentation was something that Matt Runyon said that I think was really worth noting, and that is that in addition to disasters becoming more frequent, more complex, and more severe, the responses are becoming more data-driven. And we not only need to think about Matt's area, which is how do we ensure data availability, but getting on to a presentation in the last session about how we need to, like patient care, become more evidence-driven. We need to think about how we can utilize those data to become more evidence-driven, possibly during the immediate response, but certainly as we formulate our lessons learned and how we need to change things for the next time. And because we're running out of time here, I want to take the last couple minutes by talking about the other sort of elephant in the room here, which was acknowledged, and that is our changing climate. A lot of people talked about how our world is changing. I think at one point we had a prayer session because people are concerned about the way the current administration is looking at this. I think we need to get out of that mindset. I'm not an emergency medicine physician, but because of being in this line of work, I've rubbed shoulders with a lot of emergency medicine docs, and they're kind of like poison ivy. You know, it rubs off on you and it stays with you. And it changes. And one of the things that emergency medicine docs do is they look at the patient and they say, what's going to kill him or her right now? And that becomes their first priority. Everything else follows on from that. I suggest to you that climate change is the thing that is going to kill us. And if we don't reformulate our priorities along that realization, a generation from now, people are going to look at us and say, what were they thinking? And it's worse than we realize. No one in this room talked about the emerging bodies of knowledge about how our ocean ecosystems are on the threshold of collapse. No one talked about the stuff that's really hit the public eye just in the past few months about the catastrophic decline in insect populations. We humans are the apex predators in this world. And what that means is when the base of the pyramid gets knocked out, the apex has the furthest to fall. And I suggest to you that we have spent too long wringing our hands about how a certain network is spreading misinformation and disinformation. They do not control the public space in the United States, and they certainly don't control the public space globally. We need to think about how our work can help inform the public discussion and inform the way policymakers who are elected by that public react to it. And in the last couple days, since I've been here, I've begun to think that maybe an individual that we need to look to as we think about how to do this is Dr. Martin Luther King. Because Dr. King changed the way the world viewed a topic. I will not suggest to you, especially those in this audience who are people of color, I will not suggest to you that we live in a perfect world, but it is a very different world than when he started his work. And I think the fact that Dr. King and the movement he led were able to change the conversation and change expectations and change behavior and change society gives me confidence that we can do it too. And that literally for the future of mankind and the future of the ecosystems that we currently grew up with, we have to do that. And I appreciate the opportunity for this soapbox. And I look forward to continuing conversations with all of you about how we approach that. Thank you very much.
Well, congratulations, we all survived. Thank you, Scott, that was a great summary. And I think that call to action at the end is critical. A number of the speakers here have mentioned the issue that the world's gonna face going forward. We all know, just looking at the numbers, that disasters, particularly climate-related disasters, are increasing. And it's just starting now. We have a long way to go. So I want to thank a few people. I want to thank the American Geophysical Union for hosting us and enabling this conference. I think they've been a tremendous asset. We actually had some hosts. You got coffee because we can't buy it for you. So the Society for Disaster Medicine and Public Health in Cambridge donated to the American Geophysical Union, who provided the coffee for you. And I want to thank our speakers, I want to thank our panelists, I want to thank our staff, particularly Alice O'Donnell, who kicked booty putting this thing together. It's been a tremendous asset for us. And so this has been a simple continuation of a conversation that's been going on for a long time. You know, it particularly, it had a crescendo back around 2010 through 12. And it's moving forward now. And bringing everyone together here and all these different people is an important start to re-continue this conversation. We have plans as a national center to do this both within the federal agency and within our federal partners, but we're going to put out a series of white papers, we're going to hold a series of webinars. We want to make sure that the conversations continue amongst all of you going forward. I think the formation of the new alliance that's coming up will be an extremely important thing going forward for the concept of disaster science. And so I just want to summarize a few of the key things that I heard from this. And the first one is, everyone here recognizes that we don't do necessarily a great job in our disaster preparedness response, and we need evidence. We need science, whatever you want to call it, to go forward to increase our capability of protecting the lives and the health of our nation. And whether that's a national disaster safety board like an NTSB as a beginning thing, or whether that's a grand plan to do that, we need evidence to make this world a safer place, particularly given what's coming for us in the future. Number two is, this is only going to occur by collaboration. I think pretty much every speaker here said that, and I agree with that deeply, and that's been my career. And I think that, again, this is a good start for that. Number three, so the collaboration has to just be between not just the disciplines, but everybody, and I think that is a gap. Everyone's emphasized the community, the responders, the government, everyone, private sector needs to be involved in this conversation going forward, and we all need to work on that to do that. And finally, we talked about the need for funding, and it comes back to that. And again, I've had a long career struggling for funding, and if you just look at it simply, Julie presented that in 2017 alone, $340 million were donated to disaster response by private sector. If we took 1% of that, that would be $3.4 million in additional resource to do research and to improve our response and to improve our preparedness. A bigger example, and my dream, if we take the $89.3 billion supplemental that was paid in 2016 by the federal government to respond to the hurricanes and fires, that would be a small sum of $890 million in disaster research funding. So somewhere between those ranges, if we can figure this out, if we can appropriately balance our approach to these things, would be a good thing. But science drives change, and science drives good change. And just doing AARs and subjective feelings and communications without defining things will not do change, will not provide the optimum change and the optimum future for us. And so we need to, as a group, work to make sure that we do that. So feel free, again, we intend to continue this conversation now for years, hopefully. Reach out to me, reach out to the National Center, whatever we can do to support your efforts and to support your work in this area, and to continue this conversation and collaboration, let us know, and we'll be happy to try to help you. So thank you very much. Yes. So the Alliance, we're meeting, it's not a secret, it's down in the basement, it's in the third rock room, and everyone's invited to that. the people who can only vote on the charter will be center directors. But anyone who is interested in learning more about this alliance and about what the plans are for the future, please, you're invited to it. It starts at 1 o'clock, third rock room.